There's a big, big, big gap in what people need to really, truly be what we, I think, collectively view as healthy. But this really looks at those social care needs that people have, because without a safe home, without food on the table, you really can't say that somebody's truly healthy, even if they're doing everything that they're told by their doctors they're supposed to do.
Heali was formed to bring together providers of the region to build a social care infrastructure. We're a network of about 100 community-based organizations and healthcare providers looking to integrate healthcare and social care together. We're screening Medicaid members to identify health-related social needs and then connecting them to services like nutrition services, housing services, care management.
We have two levels of services. We have services that already exist, and we have what's called enhanced services.
And so every Medicaid member in Long Island is going to be screened using a common screening tool. And that is the entry point to be able to access the care that they need.
So the first step is really the Medicaid members connecting with our broad network of social care navigators about what they're experiencing in their life, what needs they have, so we can best serve them.
Community health workers are the front line of reaching out to the most vulnerable members of our community.
I'm able to tell the people about the different doors that are there, and if you knock on them, they can open and you can get what you need.
It's hearkening back to how we as human beings are supposed to live, where we're supposed to live in a village, and the village takes care of you.
First of all, I have a lot of health issue situation going on right now. I'm diabetic, I have lupus, which I cannot deal with stress. And I didn't feel like I was getting any help. I wasn't being listened to like what I needed. And I contacted Heali, and I wanted to find out if I qualified for any of the helps that they were offering. And I never got this kind of help so fast. I mean, it was like a start. I get somebody else who's working on something for me to make my life easier. And I think we all need that, like especially when you have so much situation going on, we need the help.
We all love the organizations that we work for, but our collective mission on behalf of, 265,000 enhanced Medicaid lives and probably 600,000 lives beyond that is paramount and is more important.
Heali has developed a platform for us to come together and work together and to find value in our differences and to not feel threatened by the fact that you may do something better than I do.
Not only are we the ones identifying and connecting people to these services, we're actually working with the other community-based organizations with those Medicaid dollars. We're helping distribute it. We're actually helping develop other people's infrastructures, other organizations' staffing, workflows, and their skill set as well. I would call us maybe the tide that is raising all boats.
Working with Heali became more than just referral. It allowed us to actually bring our best thinking, put it on the table, and see how we can make it all work to make this community healthy.
Technology is a big part of what we do. That's what we use to do our work, to get our members connected to where they have to get these resources.
It's a technology platform that all of the community-based organizations and the healthcare systems are using, as well as our federally qualified health centers and our hospital system, because then we have eyes on all of the information and we have the data that's associated to be able to measure the impact of the services and the connection.
I now have access to a plethora of resources that generally I would probably have to fight through to get to them. We now get the ability to touch lives that we normally wouldn't even see or know. So it doesn't just help us do what we do better, it helps us do more of it.
Really, with Heali, it started January 2nd of 2025. But we can see the impact already. People are getting access to the services and the resources that they need to ensure that they have a good quality of life.
There's always room under the tent for more providers with us, and we always welcome more providers. But how do we start to dig deeper also so that we have better coordinated care and integrated care, putting the person at the center so that someone's not thinking about social care over here and health care over here, but we're thinking about ways to bring that together.
It's about getting people the help they need because they're human beings and they're vulnerable, And we would all need that and want that if we were in that situation.
I don't know what part of a person's growth I am. I don't always get to see the flower bloom. But with Heali, I get to see more flowers bloom than I have in the past.